Hi there, welcome to my channel. So here in this video, we'll be discussing about upper motor neural lesions and lower motor neural lesions. It's kind of short video, like we'll be having like quick review of this topic. So before we start, I would like to tell you one thing. Whenever you sit to study, you don't just try to remember everything. You try to understand what you're reading. Like you should literally break down the title. If you break down the title, you're already half done, and there's a lot of information in the title itself, and it reduces a lot of work. The thing which we usually do is like we'll try to remember everything what we see and what we read, but actually we should break down the title. So let us use the technique in this topic. So our topic goes like this: upper motor neuron lesion and lower motor neuron lesion. Fine. What's the lesion mean? I think you're all familiar with this. And lesion is in general, it's like any damage to the neuron, not to the neuron, anything. Like it's any damage. Well, we already know that how our brain respond to a stimuli. Like there'll be a stimuli, and then and that information will be passed from the receptor organ to the cerebral cortex, and that's called sensory tract or ascending tract. And when it's come to motor, then for that stimuli, the response will be like the information will be sent from the cerebral cortex to the organ. So and this will be like descending tract. And descending tract, I think you already know about this. Like there are so many, yes, so many tracts like reticulospinal tract, cerebrospinal tract, vestibulospinal tracts, and so on. You can refer to your text about more descending tracts. And so when we analyze a title like upper motor neuron lesion and lower motor neuron lesion, so we have already know what lesion is. Like that's any damage, but the damage, where the damage is, so it's in motor neuron. So where the motor neuron is, it's in descending tracts or like motor pathway. So this will be usually consisting of chain of neurons, first, second, and third order neuron. Well, we have broke down two part of our title, that is lesion and motor neuron. So now we have clarity about motor neuron and lesion. And now the remaining part is like upper and lower. What does it upper and lower means? Where does it upper start from? And from where we have to consider it as upper. So let me tell you, like any lesion that is above the anterior horn is called upper. We can consider that as motor neuron lesion. So that's the reference point. Again, why anterior horn? Because that's the place where motor neurons are located in spinal cord. Well, now let's go to low motor neuron lesions. So this is a lesion anywhere along the nerve fiber between the anterior horn and the relevant muscle tissue. Well, let's recall it again. So upper motor neuron lesions, it's like the lesion above the anterior horn, or like a lesion in the motor nuclei of the cranial nerves. And lower motor neuron lesion is like anywhere along the nerve fiber between the anterior horn of the spinal cord and the relevant muscle tissue. So let's talk about some features of upper motor neuron lesions. So here usually atrophy is absent, and also fasciculations are absent, and then central paralysis. So this is like usually weakening of muscles in that actually occurs in face, actually, like facial muscles. So this condition is actually characterized by like inability of voluntary movement in, and this will be in combination with increased tone, and this will be like you can also call it as like clasp knife phenomenon. I would like you to search about this in YouTube, like how this test is taken. Okay, and also the decreased power in muscle groups. Remember muscle groups. Okay, and then hyperplexia, and the effect of this on bladder function is like detrusor hyperplexia, and one more thing is like Babinski sign, and I think you already know about this. If you don't know, I just want you to check this on YouTube, and and this will be positive for upper motor neural lesions. And some of the etiology of this is like multiple sclerosis, tumor, stroke, and vitamin B12 deficiency, and ALS. So now let's see about lower motor neural lesions, and here atrophy and fasciculations are present, and peripheral paralysis is also present here, and here the inability of furniture movement with combination of decreased tone, that is like no class knife phenomenon, and here there will be like decreased power in single muscle fiber, and also like there will be hyperplexia here, and the effect of the bladder effect on the bladder will be like overflow incontinence, and when it comes to Babinski, and this is actually negative for low motor neurons. So the etiology is like peripheral neuropathy, poliomyelitis, and ALS. Well, that is it. Hope you learned something. If you found it useful, I've just put the image in the description below. You can. Don't forget to like, share, and subscribe.